advanced care planning in an interesting way kind of pays dividends. If you're creating organizations, systems, spaces where people can share what matters most to them, where people can share their values, where people can articulate their wishes, and there's folks who are ready to hear those things and honor those things, respect those things, act on those things, then you're creating organizations and systems that are going to treat your patients and residents pretty good across the board. You're creating a system that's treating people well and putting people first. So it pays dividends when you do this work to embed practices that are going to support advanced care planning. I lead our foundation's Speak Easy Howard campaign. It's our way of helping make it easier for our residents to begin advanced care planning by naming a healthcare agent. We ask residents to think about what matters most to them, what things are important to them, what do they value as a person. And then we ask them to identify an individual. Some people call it a surrogate decision maker, some folks call it a proxy, we call it an agent. It's who's going to speak for you when you're unable to speak or communicate your own wishes, particularly to your healthcare providers. It's our way of, as we like to say, shrinking the elephant, making what can be bigger and more complex and scary to a lot of folks, this idea of a plan, to say, start with the agent, and it is going to have a real impact. I really like to talk about this as, I'm going to say, a full court press, but give me a little bit of grace because I don't know that much about sports. So if that's the wrong analogy, just go with me. But it's this idea of making sure that stakeholders and partners across your community in different spheres are talking about this idea of advanced care planning. We heard from a lot of people who have worked in this space for years that when it's siloed, when individuals are only hearing about the importance of naming an agent from just the doctor, from just their lawyer, then it's real easy to not prioritize that. We wanted to make sure that people were hearing about it across the community. Imagine a ladder, envision a ladder, and we had 4 rungs on this ladder. And we said we want to make sure across each of these rungs, people are hearing about the importance of naming an agent and have the tools to do so. At the first rung, think about, we call that the individual level. You're a person just sitting in your home and you say, you know what, I know I should really do this. I'm ready to get started. We have created a website, a space for you, speakeasyhoward.org, where you can find tools, resources. You can even electronically identify and name your healthcare agent, which, because let's be honest, who uses paper anymore, is really important. So you, from the comfort of your own home, as just one person who's ready to take action, can find the tools to do so. Then let's go to the community level. We wanted people to see this discussion about naming an agent in the community. We were able to partner with our local Festival of the Arts and bring in folks like the improv troupe, Second City from Chicago, have them come in and do a whole show about end-of-life experiences, and then talk about how important it is to name your agent afterward. We were able to do a storytelling event where people shared personal experiences, and we encouraged folks to name an agent. We also provided grants to community groups. Let's say you wanted to host a book club or a movie night where you were looking at a film about an end-of-life experience and you wanted to bring some people around to your house. We were able to provide small grants to some of our community organizations that were engaging in some of those community touch points. That was another rung that we wanted to make sure was covered. So let's go up another level to the organizational space. We wanted to help organizations embed advanced care planning into their processes. Our local hospital has been a fabulous partner in this work as well. We wanted to make sure that there were organizations here in the community that when you enter those doors, they are structured and set up in a way to help you name that healthcare agent. Lastly, the top rung is institutional. It is what sustains all of this. It's how we get it embedded. And we have been staunch advocates and really been present in our Maryland General Assembly over the past few years, pushing for legislation that's going to make it easier for people to take these critical steps. First, I would say make it easy. Shrink your elephant, make it accessible. Find a way to make whatever it is in your community feel like this and bring it down to this. Give folks a place to start. That is crucial. We also focused for a little while on the sandwich generation, that 40 to 60-year-old population, knowing that they perhaps were considering how to help an older adult or a parent plan, but then they're also looking back at their children and saying, well, I want to make sure I plan and leave you a sense of what matters to me as your parent. And so that was a group that really was poised to engage and hear this particular message. And that might be a place to start as well, is consider the population maybe that you want to start on first. I would say stay the course. As we've heard through the Speakeasy Howard program, as you can hear from others who work in this space, it has a real impact. Having conversations, naming healthcare agents positively impacts, and reduces that stress and burden on families down the road. It does matter. So stay the course. The last thing I would say is it's okay to start small. You may not be able to bring in the Second City Troop from Chicago. That's okay. Pull together a couple of stakeholders, a couple of people on those different rungs of that ladder, and start small. It is going to make a difference. If you are beginning to change the narrative, if you're creating spaces for people to engage in this, if you're doing it so that they're hearing it across the community and not just in one space, you're going to change how people see this. You're going to change how much people are talking about it, and you're going to have an impact. So that's what I would say.